Hello, my name is Paul Thomas. I'm a family medicine doctor, and I'm talking today about why generic medications are so expensive. I read a great article recently about the variability in price among generic medications, and the article is involving heart failure medications, specifically lisinopril, digoxin, and carvedilol. So, just as a 10,000-foot overview, about 5.7 million Americans suffer from heart failure, and it costs our economy about $30 billion each year. The CDC has this fact sheet. I encourage you to check it out. There's also a map that shows the burden of the disease across the country, the heart failure death rate with the red, darker red spaces, meaning more people are dying from this in those areas. I reached out to this author because I was really interested in the article. His name is Paul Houtman. He told me a story about one of his patients paying $100 a month for digoxin. $100 a month. And he had said that this was a low income patient who really couldn't afford that much money anyways. So that's way too much money to spend on one medication. And I'm going to show you how I could save you money in this space. And we'll talk a little bit about that later. But first, the article. So generic medications like digoxin, lisinopril, and carvedilol shouldn't be that expensive. And this article gets at why they're so expensive in the marketplace. So they looked at 55 different zip codes, 2 states, 153 chain pharmacies, and 22 independent pharmacies. And they came up with this beautiful map of all the different pharmacies in their area. They're working in St. Louis at St. Louis University. These dark red dots show the people who are paying more than $150 for those 3 medications, lisinopril, digoxin, carvedilol. And $150 is a lot of money for generic medications, and this is every month. So imagine spending $150 every month. That's maybe close to $2,000 a year on your medications, versus these darker blue dots, folks are paying less than $20 for the same medications. So the same medications, those same 3 medications, digoxin, carvedilol, lisinopril, were costing folks less than $20 a month. That's much more reasonable. That's an annual cost of about, $240 or so. And then in the middle, you see the yellow dots. Most folks are paying between $50 and $100 per month for their medications, all 3 of those medications. They put this out in a chart. You can see that the average cost for digoxin was in the $40 range. The average cost for lisinopril was $10 to $14, and the average cost for carvedilol was $14. All told, these 3 medications together cost between $67 and $70 on average for consumers. I say that amount of money is way too much money. So the primary cost driver for these medications was the retail pharmacy itself, not the duration of therapy, the drug dose, the pharmacy ownership, or the pharmacy location. And they even looked at different income level communities, and they found that there was variability independent of the income of the community. And that is written up in this paragraph here. Pricing did not vary by median annual income, clusters corresponding to high, moderate, or lower incomes. So I really encourage you to read through this article. It's a really fascinating article. But what I want to talk about right now is how I can save you money as a direct primary care doctor. I work for Plum Health Direct Primary Care, and the way we can save you money is by wholesaling medications. I'm going to give you the examples here. So for carvedilol, it's $10.14 when we buy 500 pills. So that's 2 cents per pill, and that's 60 cents for a 1-month supply. Compare that to $14.76 that the retail pharmacies are selling this medication for, as evidenced in the JAMA article, and we can save you $14.16 per month. Lisinopril, 10 milligram tablets, we wholesale 1,000 pills for $10.72. That's 1 cent per pill. That's 32 cents a month. And remember that the average cost was $14.18. So we're saving you $13.86 each month. Now digoxin, this is a little bit more expensive at wholesale. It comes out to about 51 cents per pill, and that's $15 for a 1-month supply. But remember, the study said that it was $40 on average when you buy it at the retail pharmacy. So we're saving you $24.80. So in total savings, $14 for the Carvedilol, $13 for the Lisinopril, Digoxin, $24. These are all the savings that you're receiving. So that's $52 a month we're saving you just on your heart failure medications. So, not to be too preachy, but when I took the Hippocratic Oath, I said, first, do no harm, and that includes financial and economic harm. So if you're one of my patients, if you're one of the members of Plum Health, I'm looking out for your best interest, and I'm going to try and save you money on your health care and show you how much your healthcare dollar is actually worth, so you can be healthier and not worry about your finances regarding your treatment. So that's all I wanted to talk about today. My name is Paul Thomas. I'm a family medicine doctor. I'll include some information in the links below and in the comments below. So reach out to me if you have any questions. I'm at paul@plumhealthdpc.com. Looking forward to keeping the conversation going. Have a great day, and I'll talk to you soon.